Good afternoon. I'm honored to continue following the governor. Thank you, Governor, and Commissioner Infante Green. I want to again thank you and your team at the Rhode Island Department of Education, as well as our team at the Department of Health and all the school officials throughout the state for contributing to our thoughtful, measured approach to schools. Please know that in every decision we make together when it comes to schools, our priority is the health and safety of students, families, teachers, and school staff. To get started with data, as the governor said, we have 74 new cases to report today. Sadly, we also have 2 additional fatalities to report. Both of these people were in their 60s. Our sincere condolences and prayers are with the families of these 2 treasured Rhode Islanders, as well as with the families who have been impacted throughout this time. It's important for all of us to take a moment to acknowledge that and to recognize that the actions we take have an impact on those families. Since I was here last week, our number of new cases has continued to be about the same, and we're still seeing way too many new cases with that. Also during this time, our hospitalization numbers have also been higher than we want them to be. I say that because we have the opportunity to correct that. It's the shared responsibility among Rhode Islanders. We are here once a week. We need each of you who are watching this to be the ambassadors, to carry this message on the other days of the week so that everyone remembers and understands how critical it is that we all buckle down and make sure that we're wearing our masks, key component, that we are keeping our groups small and stable, 15 or fewer, the same people each time. Critical component. Then we can practice social distancing and absolutely remember to stay home when we're sick. A key component also is that I've talked a lot about the factors at the community level that impact the prevalence of illness in different areas of the state. Those include things like housing and employment. While working to address those larger structural issues, we are also doing everything we can to get immediate supports into the communities that need it most. Our Rhode Island Health Equity Zones, for example, have distributed more than 1 million masks to people in the communities hardest hit. And through our Health Equity Zones, we are getting $700,000 in investments and support for resources to Pawtucket and Central Falls to help address their COVID-19 efforts, as just one example. All told, more than $2 million have been invested in our hardest hit communities. And we have leveraged the health equity zones as an infrastructure to make sure that we're engaging directly at the community level. This is an area that absolutely needs to be a focus for all of us. We are a small state. This is not a virus that respects boundaries between communities. If we cannot get our cases down in individual cities and towns, we will not be able to keep our cases down as a state. We need to make sure that we are all in this together. Everyone's actions matter. As I said we would do each week, I want to now take a moment to give you a little insight into what we are seeing in our case investigations, with a special kudos to our data and analytics and case investigation and epi-ops teams that work tirelessly to help make sure that we have data to inform the decisions that need to be made. We're still seeing, as the governor has mentioned, too many people going to work sick. We looked at cases among people who work in roughly a dozen large categories such as retail, food service, manufacturing, financial services, and real estate. And we've found that over 49% of people who work in these settings and who tested positive were at work when they were symptomatic. The week before, it was over 60%. In some instances, people were at work for days when they were symptomatic. That's why that message is critical. If you're feeling sick, you need to stay home. The other critical source of transmission that we are talking about and want to raise awareness so that everyone understands is social gatherings. We know that social gatherings are continuing to occur. People are coming together, their guards are down, they're not wearing their masks, they're not distancing appropriately, and that's how coronavirus is spreading. Older age cohorts, people who are older in age are tending to go to social gatherings to recognize life milestones such as baby showers, birthdays, graduation parties, and funerals. Our cases that are associated with younger people and social gatherings have been more associated with things like house parties, beach parties, parties in bars, and restaurants. The average number of contacts at all these gatherings for the end of July and early August was 5.4 people. So one individual, particularly the individual that we found to be positive for COVID-19, had exposed 5.4 people. I'm sharing that number to help you think about the number of people you're surrounding yourself with. And particularly if you're doing it in a gathering, in a crowded setting without a mask. Hands down, that's what makes the difference in coronavirus spreading. This virus can spread very quickly, even in smaller groups of people. To reiterate, please spread this word. Help us reinforce this. Our current social gathering size limit is 15. The smallest among our neighboring states, so that we can focus on keeping our group small and stable. But just because you're not in the immediate proximity of 14 other people, that doesn't mean that you're in the clear. You have to continue to wear a mask. If you're going to be with other people, especially other people who don't live in your household, it's imperative that you wear a mask and practice social distancing. It matters. It does make the difference. Our next trend that we are seeing among our cases that we're investigating is ride sharing and carpooling. For example, carpooling to work, as the governor touched on. When you're in a car with someone else, you are in very close proximity to that person. That is the perfect scenario where you need to wear a mask. It doesn't matter if you're in the back seat. It doesn't matter if the windows are open. Anytime you're in a car with someone else, you need to have your mask on. This is critical. It's not the time for us to get lazy or complacent. We know that this is a long-term journey. We know this journey is not easy. We also know that we can figure out a way to live effectively with coronavirus controlled properly. I know it's often hot and you may not want to keep your mask on, but doing so is critical to preventing the spread of COVID-19.